Well, flu season is back, but this year it is not just the flu itself. You have coughs and colds and other bugs making their rounds as well. Dr. Mika Schofield from Lee Health is joining us now with what we can all do to stay healthy this season. Thank you for being here, Dr. Schofield. We appreciate it.
Thank you for having me. Yes, it is that time of year.
Yes, it is.
For our seasonal viruses. And, you know, our top priority is how do we keep our community safe and healthy?
Right.
I like to think of this as getting back to the basics.
Okay, sure.
So hand washing, coughing in your elbow. But based on our most available evidence today, vaccines are the most effective way to keep our communities safe, to help prevent the infection and reduce the severity of the illness. Of course, this is a personal decision, and
Sure.
we recommend that folks contact their healthcare providers to understand what the best option is for them.
I know many times it's kind of a guessing game. You have to figure out which strains are going to be the most prevalent and spread the most easily. The flu shot, though, even if it doesn't target it specifically, it does at least give you a lot of benefits, too.
Absolutely. It can help prevent the severity of the illness, even if you do get some symptoms of the flu. This helps prevent additional treatment or even hospitalization. So the severity of the illness can be lessened.
What exactly are the seasonal viruses that you as an ENT worry about and see most prevalent?
Right. I mean, obviously there's the common cold.
Right.
Right.
Sure.
And so we all are aware of that. But usually these symptoms last for about 7 to 10 days and go away. But then there are the more serious illnesses like the flu, COVID-19, or RSV. This is important because these viruses tend to affect the lungs and airways.
Oh, wow.
In the beginning, they may present like common cold symptoms like fever, sore throat, cough, body aches, feeling tired.
Sure.
But as these symptoms worsen, people can develop difficulty breathing, bronchitis, pneumonia, and even require hospitalization.
That's very, very scary. How do we know as parents when it's time to go to the pediatrician and get some help?
Yeah. I think consulting with your provider if symptoms don't abate after 7 to 10 days, that's a good time. Or if you feel that the symptoms are worsening, you're having that difficulty breathing, fever's not very controlled with standard methods, that's a time to contact your provider or seek emergency care.
I feel like with the kids all back in school, they're like little petri dishes. You know,
They
they bring home so many different things, and it can be difficult to try to keep at bay. If we do want to go get those vaccines, where would you recommend the best place that we can do it pretty quickly?
Yeah, I mean, obviously, if you have a primary care provider, go there. But for those that don't have a primary care provider or maybe don't even have insurance, the Florida Department of Health does offer vaccines for those folks. You can also go to your local pharmacy within your community. There are also events that folks should look out for. There are events coming up in Fort Myers and Cape Coral that will offer vaccines.
Oh, that's great. Yeah, we're looking at some of those on the screen there.
Yeah.
Some of the food pantry there on Gladiolus, the Goodwill and the West Cape. All of these are available, right? You can just walk up. You don't have to call ahead?
Absolutely.
Okay. And what is the cost for things like this?
Well, the cost can vary, but some will offer vaccines for free, but the cost will vary based on your insurance.
And this is a vaccine, meaning the flu vaccine, something that we need to do every year because, again, as mentioned, the flu strain can change.
Absolutely, it can change. But it's important to get the vaccine every year because the strains will change, but also we want to keep the community safe. And so we know that if about 80 to 90% of our community does become vaccinated, then the whole community is safe from the spread of the infection.
The herd immunity kind of thing.
Yes, the herd immunity. Okay.
You could tell I've been an anchor a while.
Yeah.
What is the one thing we're doing wrong as parents and in general? Why to avoid getting sick?
Well, you know what? I like to think about those simple measures. So hand hygiene by far is the most preventive way. So we do this as nurses and doctors before and after every patient, washing our hands to prevent the spread of infection. But you could do that at home too. This can be washing your hands for about 20 seconds with soap and water or using a hand sanitizer. Also making sure that when you're sick, washing your hands routinely, before eating, washing your hands, and after using the bathroom. I think that we also should understand when we don't feel well, staying at home is another simple measure that we can do to help prevent spread. And of course, wearing a mask if appropriate.
So don't tough it out.
Yeah.
Stay home and get better. Well, Dr. Schofield, thank you so much. We appreciate you coming in and your
Thank you.
insight. And these are some great opportunities, again, to go get those flu shots. We'll have some links on our website as well as our Gulf Coast News app where you can do just that. Stay healthy, everybody.